Good afternoon, welcome back. This is Saima. If you haven't met me before, I'm a nurse from Southeast England. In today's video, I'm going to talk about healthcare support workers. A lot of people been asking me about the job of healthcare support worker. What do they do, and do they always need to do personal care only? Do they only work for do they only provide patient care, patient personal hygienic care? Is this the job only for healthcare support worker? This is all we are going to talk about in this video. Okay, so if you are a healthcare support worker, or if you want to come to the UK and want to work as a healthcare support worker, this video is for you. Don't skip, please watch the video till the end. I'm going to share some very insightful, useful information for you. Okay, I think I just need to tell you all about healthcare support worker. We often call it care assistant, we often call it HCA, healthcare support worker, healthcare assistant, carer, senior carer. These are all the names for one job only, and it's called healthcare support worker, HCSW, right? Okay, so a lot of people, a lot of nurses, even if they cannot pass their OET exam, their English exam, they come here in the UK, they work for healthcare support worker job till the time they get their OSCE, or till the time they get their OET, their English speaking test. Okay, when they pass their OET, when they pass their English test, then they start working as a nurse. They apply for an NMC pin. Before that, they work as a carer, they work as a healthcare support worker, or they work as a senior carer. Okay, just to save time while they're preparing for their English test, they work as a carer. They earn good amount of money by doing that, and they don't waste their time. It's very good point. I like that. A lot of nurses from Pakistan, from India, they've been asking that they want to join as a carer and how to apply for this job. You can apply online, you can contact through the agencies, you can come through the agencies. In India, there are lots of agencies who hire healthcare support workers. They can apply directly to the NHS, also on NHS jobs, on track jobs, on Indeed jobs, and jobs nowadays, it's becoming hard a little bit, but keep applying, and you never know when you're gonna be hired. Okay, so I would suggest you can apply for NHS jobs, on track jobs, and also you can search different kind of agencies. I also have a video on international recruitment agencies for nurses, for healthcare support workers also. So same agencies, they hire healthcare support workers also. They are not different agencies. So you can go on to that video, you can look for my video on international nurses recruitment agencies. If you want, I can give you my link also, but you can go through my channel on the videos. I have a video about international recruitment agencies. Okay, you can contact them and then ask for if they have any jobs availability for nurses or for healthcare support worker. Okay, and they are really good. They'll just send you a WhatsApp. They respond quite quickly. Okay, so you can just send them a message. All right, if you ask me personally, I cannot give a direct contact of a person. Okay, I can give you the name of the agency, so whoever is on shift, they'll respond to you. So I'm not giving you a personal contact number of one single person, even though they are from that agency. I told the names of all the international recruitment agencies in my video, so you can go through whichever agency you want to choose. You can contact them. You can just Google them and then contact on their contact number, because sometimes what happens is the person, maybe I'll give you a contact number, maybe that person is on leave, or they quit the job, or for some circumstances they are not there. So it's good to contact them directly. If you Google the name of the agency, you'll find the contact number. Just contact them and ask them if they have any jobs available for nurses, if they have any jobs available for carers. carers, okay, or for healthcare support workers. Now talking about healthcare assistants job, it depends which area, which ward you are working on. If you are a carer, if you are a healthcare support worker, you need to know your department, and if you know your department, the work is according to that department only. A lot of people, they ask me for the carers, there are loads of jobs. They do personal care, they feed the patients, they take them to the toilet, they change the sheets, they give bed bath. So everything is for carers. No, we also help you with each and everything, okay. We are a team, we work as a team, we work together. So if I'm done with my work, I'll help you also. And a lot of that most of the times if you work in an elderly ward, there are patients who needs assistance of two. So you as a carer cannot do that alone, you need my help. So two person, if a patient need two person help, so me and you, carer and a nurse, can help that patient with the turnings or with toileting or with other needs, okay. So you are not alone there, we're gonna help you with everything. So let's talk about a patient's healthcare assistant job, okay. It's their job, but it's not limited to patient care only, it's not limited to personal hygienic care only, okay. Let's say, for example, if you work in an elderly care, your job will be to provide personal hygienic care, to provide dental care, to provide feeding assistant, to provide toileting assistant if they need also for the bedding change and everything we are going to do. If you are in an elderly ward, if you work in a medicine ward, if you are work in a geriatric ward, these will be your jobs, okay. Now talking about another healthcare support workers job, if you work in OPD, there you are not going to do any personal hygienic care, you are not going to do any dental care, you are not going to provide any care with the toileting or turnings or anything, because in OPD patient come for few hours or few minutes, or let's say for half an hour or 1 hour, so you don't need to provide those things, okay. If you work in a OPD, your jobs may be just to do vital signs of that patient, or check height and weight of the patient, or to transfer a patient to somewhere, or just to assist the nurse if she needs any help, okay, or directing the patient where they need to go. So for the healthcare support worker, if they work in a different department, if they work in OPD, these will be their jobs. If they work in a maternity department, maybe they need they'll help the new mom to feed, or they'll help the new mom to take care of the child, okay. So if you are in a maternity ward, if you are in theater, operation theater, then your duty can be in pre-op patient, where you need to just talk to the patients and reassure them, give them some reassurance, ask them if they need anything, or just to do their OBS and everything, but not personal hygienic or care, or not personal hygienic care or dental care or toileting or anything like that, okay. So you can also work in a recovery room, operation theater. Usually healthcare support workers, we work in pre-op, post-op or recovery rooms. In the recovery room also, you are just going to look after patient, their OBS, and also if they need any support while you are there, but not mainly personal hygienic care, okay. Because I don't know why people, they don't like doing personal hygienic care, but if you are there as a carer, as a nurse, me, I don't have any problem checking patient skins, I don't have any problem giving them bed baths, because if you do bed baths, if you help the patient in toileting, at the same time you can check their skin also, so it is a good opportunity for you. You don't waste your time, you provide bed bath, in the same time you check patient skin also, and also if there is any other signs that you need to be aware of, if there is any cut, any bruise, any injury, you can go through that quickly, okay, at a time. You are doing bed bath, you can check the skin also. So I find it pretty quickly. Even if I need to go take the patient to the toilet, I can check their pressure sore also at the back, if they have any on their bum, if they have any sores or any kind of injury or any kind of skin issue. Okay, so it's good. Also, if I'm feeding the patient, it's good for me. It will be better for me to plan to make a care plan for the patient, because if I can see patient is eating, I'm feeding the patient, I can see if the patient is eating well, so I can write it in the patient care plan. If I see that patient is having difficulty in eating the food that I'm giving, maybe I need to alter that food. If patient is having difficulty in eating solid foods, maybe I need to give a puree food or other sort of food, or if I need to make any referral for the speech and language therapist or to other senior carers, to see other any specialist for the food or anything else. Okay, so if I'm feeding a patient, I have the opportunity to look for other options as well, right? Me as a nurse, it will be good for me to do all the things all together. Okay, even though if I am turning a patient, if I'm helping a carer to turn a patient, it'll be good for me to know whether my patient can turn by himself or not. Okay, do they need one person in turning? Do they need 2 person in turning? How is their mobility like? So it'll be easier for me to make their care plan on their mobility. Okay, so what I'm trying to say is, most of the times, if nurses, they don't help carers, it will be hard for them to make a care plan also. So as nurses, they should consider all things together. They should work with the carers as well. And to be honest, we do help as much as we can, but sometimes with the medication rounds are too long. Like if I have 10 or 20 patients, like 15 patients, I'll be finishing the medicine round in 2 hours. So, and then by the time I finish the medicine round, there'll be other things like OBS I need to do, or I need to check the skins, and also there is lunch time. So there are other things also that I need to consider. All right, so I think if patient load is less on a nurse, they can manage better, they can manage all the care better. Okay, we went off the topic, isn't it? All right, let's go back to carer's job. Now, yes, so carers can work in OPD, in operation theaters, in general medicine, or in endoscopy, or any other department, or eye department, or orthopedic department. In orthopedic department, he'll be more concerned about mobilizing patient, taking them to the toilet, or taking them for a walk. So carer's job is not limited to dental care, not limited to personal hygienic care. Okay, don't think about it. Just think wisely, and then you need to choose a department where you feel comfortable with, where you feel like you can work, and also where you have experience, isn't it? If I have experience in pediatric, I'll go for pediatric department. Same is for the carers. If they have experience in pediatric, they should go for pediatric ward. If they have experience in OPD, they should go for OPD department. My baby is pushing the tripod. That's guys. Why I don't make videos nowadays, because he wants to hold the tripod all the time, and if he is asleep and I make video, he'll be awake. So I try to do it when he's awake, so he doesn't get disturbed, right? Okay, so for healthcare support workers, I forgot to mention, sometimes healthcare support workers or carers, a job is just to transporting patients from one department to another department. For example, if they have to take patients for a CT scan, or for MRI, or for any other procedure, ultrasound or something, if patient is in the hospital, in the ward, yeah, inpatient patients, if they have to take the patients to for different scanning, they can take that patient to the scanning rooms. Okay, sometimes their job is only that one. Also in the discharge lounge, if they work in a discharge lounge or something like that, then their job is only to transport patients as well from one department to another department. If they have to take a patient from my ward to a discharge lounge, or if they have to take patient discharge from the discharge lounge to the to another department, or from the ward to the discharge lounge. Sometimes their job is just to transport patients. So healthcare jobs is not limited to personal care and dental care. Sometimes if you're working in a geriatric ward, if you're working in an older person's medicine ward or medicine ward, sometimes we assign healthcare support workers to only watch a dementic patient. If there is any patient with dementia, and if they have aggressive behavior, or if they have different behavior, or if they are wandering around, or if they are just touching the other things of from the other patient's beds, so that time we just assign that healthcare support worker to look after that person only, providing that we don't have any mental health nurse. So if we don't have any mental health nurse, or if we don't have any other staff, we also assign healthcare support worker to look after that person, just to be with them, or just to walk around with them. Okay, so healthcare support workers job is not limited to only those jobs that I mentioned previously. All right, so I think if you are in the ward, if you are in the hospital, you can do whatever you have to do, isn't it? You can do your job, you can do personal hygienic care, you can do dental care, and everything goes behind the curtain. So you shouldn't be ashamed if you are a carer, if you are a nurse, if you are a doctor, or if you are a carer. You shouldn't be ashamed of doing anything, because it's part of your job. Okay, carer means care, to provide care in anything, isn't it? Wherever patient needs care. So we as carers, we shouldn't be ashamed. If you feel ashamed of doing this job is not for you guys. Okay, if you don't feel confident enough, if you need some training on that, go for that. You need to have that training. If you don't need the training, you just don't feel confident in doing it, you just don't feel comfortable in doing it, then this job is not for you. If you are a carer, if you do want to do this job, you should have passion for this job. Okay, and if you don't have passion for this job, it gets difficult, it gets hard, and you will not like it at all. All right, that's all I can say for this video. Okay guys, good luck. If you are a nurse, you want to come here in the UK, want to work as a carer, you can do that. It's a good opportunity. You learn a lot while you work as a carer. You learn, you get the time to do your English test also. Okay, thank you so much for watching guys. I hope you like this video, and I'll see you soon in the next video. Till then, take care, bye bye. Please let me know in the comment section if you have any queries. You can share this video with your friends and colleagues as well. Take care, bye bye.